And I remember how our people pulled together as a nation to help each other. And that is, frankly, what has made America great. And we in Oklahoma are very fortunate that we live in a state that whenever we have tornado, grass fires, floods, whatever it might be, that we are a charitable people, that we believe in helping our fellow man, that we believe in giving of ourselves, and that we pull together as a state. And I mention all that because as we're thinking about the future of our nation and where we're going, I still have hope in America. And I still have hope in the people because I've seen the goodness of Oklahoma and I've seen the goodness of our people. And by the way, I don't think we should ever have to apologize for being Americans to any foreign country. And by the way, none of you in this room looks like a mob. None of you look like Nazis. I don't think that any of you are un-American. I think you're patriotic, good Americans that care about your Speaker Pelosi has it wrong.
Way wrong.
You're just people who care about the future of your nation, who care about your state, who want your voices heard, and that's what I'm here for. And it is very helpful for me, for you to come talk to me and express those opinions. And I appreciate you being orderly and doing that with me. So that all being said, our nation is facing some challenges. We have families that are hurting. We have businesses that are suffering. We have people that are losing their jobs, people that are concerned about paying for health care, people that are concerned about decisions being made in Washington, D.C., and how that will affect our future, our present, even our children's future. They're concerned about the massive spending in Washington. I'm very concerned about that too. In fact, I don't understand the philosophy that you can just spend your way out of financial troubles. That's never worked in my household. And I'm very concerned about our national debt, the money we owe to foreign countries, our dependence on that money from foreign countries. I'm concerned about our national security, being indebted to other people. I'm concerned about our economic security, and I'm concerned about our family security. And when you have the kind of debt that our nation has, the kind of massive spending on programs, and a system in Washington that right now seems to want to pick winners and losers in the free enterprise system, who should be helped and who shouldn't, it's scary. Because we've been blessed to live in a nation to where we value hard work, we value the freedoms that we have, but it seems like, to me, some people wanting to move us away from this democracy and freedom that we have into a big government, big brother takeover of so many industries. Socialism, is that the word? By the way, I don't support socialism, just to put it right up front. And that all being said, there are challenges within our economy. And I'm very concerned about some of the decisions that are being made in Washington, D.C. I'll just tell you up front, I did not support the stimulus program, $787 billion of spending. I did not support the omnibus program. I did not support a majority of the budgets that we passed because there's so much increased spending in those types of programs. I did not support cap and trade. I will not support a government-run health care system. I do support making sure that your savings, your deposits, your 401ks your bank accounts, the ability as a small business person to be able to borrow money, to run your business, to borrow money to buy a house. I do support making sure that our financial institutions where you put your hard-earned money are safe and secure. I do support that. In fact, let me ask you this. How many of you have lost money in your 401ks? How many of you would be devastated if your bank closed? All of us. All right. How many of you have a small business where you haven't been able to get a line of credit or haven't been able to get the home loan that you used to be able to get? Now you got to get 80%. You only get 80% financing. Those are some of the challenges that we face. And I want to talk to you about two really big issues, because we got a lot of things to talk about, and then I want to stop in it and let you talk to me about your issues real quick, which are my issues too. But one is, we're very blessed to live in Oklahoma where we have an abundance of land and abundance of water. We haven't had some of the housing challenges that other states have had. We have had some shortfalls in our budget in Oklahoma, but we haven't made some of the massive policy mistakes that states like California has made, where they have a $26 billion deficit. So we're very fortunate to live in the state of Oklahoma. And we're very blessed to have a lot of natural resources, where there's water, where there's oil and gas, alternative forms of energy. And right before the 4th of July, we started a major policy debate on energy policy. You got to have energy to heat your homes, to put gas in your cars, to deliver your products to the marketplace when you transport goods in the business sector, or even to run a manufacturing plant, whatever it might be. You got to have energy. But for the life of me, why we would think in Congress, and I did not vote for this bill, a piece of legislation called Cap and Trade. Exactly. It's a cap and tax. We just need to call it like it is. It's a tax. It's an energy tax. It's a scheme to get more money into the federal budget to do whatever. And we passed that piece of legislation. Not with my vote, not with any of Oklahoma's delegation's vote, I'll tell you that. All of our Oklahoma delegation in a bipartisan way voted against it. Because cap and tax says that if you have a business that pollutes, that you can go somewhere up here and buy this imaginary credit from someone over here that doesn't pollute, and to me it's just another scam at Wall Street, frankly. It's going to make these people in the middle rich, but anyway. You don't want to destroy your environment, your land, your water, and your air. Just don't do it. Incentivize people to not do that. Now, I am a huge proponent and a believer that we have a God-given responsibility to be good stewards of our land and of our water and of our air. So I believe we have the obligation to do that. And we have to do it in a way that doesn't destroy our economy, cause us further dependence upon foreign countries for their oil. And how somebody could think that if you restrict drilling and production and you put more taxes on energy and cause utility rates to go up by 30 to 50%, that's going to help reduce our dependence on foreign energy. I don't understand how that formula works. And it will be devastating to Oklahoma's energy sector. It will cost us jobs. It will cost us loss of value in our economy. In fact, we've had a budget shortfall in Oklahoma because our gross production taxes are down around 75%. Cap and tax does not work. And it is estimated that it will increase the utility costs on everyone, but especially hit the poor and the elderly, those on fixed incomes, the hardest, because we're talking about a 30 to possibly 50% increase in utility costs, even on business. If you own a business and you use a lot of energy, guess what? You're going to have to pass that cost increase down to the consumer. So it passed the House. All of your Oklahoma delegation voted against it. It is in the Senate. I hope it dies in the Senate. From what I hear, the senators are so nervous about their re-election chances in 210, they're going to kill us. Now I want to move on to another big issue, and that is an industry that is 17% of our national economy, and that is healthcare. And I am very concerned about the type of healthcare reform we've been discussing in Washington, D.C. Let me just say that I support healthcare reform in a free market system. And I will not support any type of government bureaucratic takeover of your health care, of my health care, that will socialize medicine in the United States and develop a single-payer system. I will not support that. I happen to think you'll make better decisions about your health care than some federal bureaucrat that doesn't even know your name. All that being said, healthcare costs too much. It is unreachable by some families and businesses. We have to lower our healthcare costs in America.
Tort reform.
I'm for that. I'm for that. We have to have better access to healthcare. There are those who just can't afford it. There are those who are out of work and they don't have health insurance. But America is very fortunate to have quality health care, lots of options, and any time you take away those options and the patient choice and you put a federal bureaucrat between the patient and the doctor and someone right in between telling you what you're going to do and what you're not going to do and how much you're going to get and how much it's going to cost, that's a recipe, that's a prescription for bad health, in my opinion. This is what they're talking about doing. I would lift it up, but it's 8 pounds. Maybe I'll just lift it.
Can you give me a second to read that?
Now that's how thick that health care bill is. Now I will tell you that this is not the final version of the bill. This is just what has come out of committee so far. It hasn't even come to the floor of the House, so it'll change a lot of times. A lot of people say, well, read the bill. I'm trying to read as much as I can of it, but I will tell you that the average American citizen, even probably an average congressperson, wouldn't be able to understand all the things in this bill, because there are sections in there that will say, like, amend section 307, subsection B, part 4, delete. Who knows what that means? But there are good summaries and briefs and good information about this legislation, and I am glad that so many Americans are paying attention to this, because our personal health, 17% of our economy, and the way we deliver health care is something that we should debate in this nation, and that we should have an open and public forum, and that's why I'm having this forum tonight. So the way our current system works right now in healthcare, you're here, you go to your doctor to get your healthcare delivery. He tells you what he thinks needs to be done. And then if we're fortunate enough, you may have private sector insurance. Maybe it's government insurance, Medicare or Medicaid. Could be any of those things. But you have options. You have options. You have plans there. But the current proposed system that we're talking about, and this is taken... Does everybody understand this real clear? No, I don't understand it either. This is actually a schematic done by a committee in Congress, that has taken this legislation and trying to dissect all the different groups that you as a patient and as employers and how you would get through the whole system. I don't know about you guys, but sometimes it's complicated right now just to file for insurance, especially if you're in a medical office trying to figure out what it is you can cover and what it is you can't cover. And if you're on Social Security or if you're on Medicare or Medicaid, those systems sometimes frustrate people because they call my office and I know. But this is what we've been talking about, is turning our health care over to some type of big brother, big government system. Now, last time I checked, there's a lot of people from Canada that come to America to get health care. And last time I checked, in some of these other European, Canadian areas, people are waiting long periods of time because they can't get health care. And by the way, their governments, most of the other countries that have some form of socialized medicine had to increase taxes because they can't pay for everything. And there is no doubt that we have a system that needs reform. To me, it doesn't make sense that we have people that have to go to the emergency room to get basic primary care, which costs too much money. And then for those of us that are fortunate enough to have insurance, guess what happens? We have to pay for that anyway. It's cost shifted on down. But there are ways that we can reform our healthcare system without going to a system to where a federal benefits board, wherever it is, here it is going to counsel you on what you can have and tell your doctor what he can do in your hospital, what they can do. And putting someone in Washington, D.C. that doesn't know your name in charge of your health, to me, is a scary proposition. I don't want that. You've heard different things in the legislation about the benefits board that will set a public option plan, but yet they're also saying you could have your private plan. But the bill also says that if you're an employer and you do not provide health insurance, that they're going to put an 8% tax upon your business. Can I see everybody's hands in here that's in business that doesn't mind paying another 8% in their cost of their overhead? And then those who are individuals that are employed who may not have health insurance, you'll also be mandated to pay a 2% tax, so you'll have a 2% increase in your costs to your family budget. $818 billion of tax increases in this legislation, $1.6 trillion over 10 years is what we're talking about. Now, Mike, so what are we talking about trying to accomplish? We're trying to get people health insurance coverage at an affordable cost. You hear the numbers that there are 47 million people in America without health insurance. There are different groups of people in the system. There are some that are eligible for Medicaid, and some that just don't even know that they could get it. But there are some that are in the lower income areas that could get some Medicaid help. There are about 10 million illegal immigrants that would be covered in this legislation. Hope you don't mind. They don't cover us. I've never been to Mexico to get health care free. And I'm not picking on that country, by the way. I love the Hispanic population. And then you have young adults between 18 and 34, nice population base, that don't have health insurance coverage, some because they can't afford it, some because they think they're invincible, like my children that are in college, and some that just choose not to. And I've got some friends my age that say, I make plenty of money, I'm just not going to buy any health insurance. Something happens, I'll just pay for it. There's actually people that believe that. I think it's kind of goofy, but that's what they think.
It's called choice.
So we're thinking about, what we're talking about is adding $1.6 trillion of more debt upon our nation over a 10-year time period to cover somewhere around 10 million that truly can't get insurance because of some pre-existing conditions or because it's unaffordable for them to buy. So I don't believe we should be a nation that just says we're against something. We need to be a nation that's for something. I am for health care reform. So how do you do that? Or actually, someone said, well, why don't you, why, tort reform, yes, that's true. Someone said, why don't you offer some type of, thank you for coming, why don't you offer some type of legislation? There are actually lots of pieces of legislation out there. We just can't get them to the floor to vote on because Speaker Pelosi has one track and one track mind, and that is the socialized medicine. In fact, Congressman Barney Frank, who I serve with, you want to watch YouTube, you can see him. It was not too long ago, someone was interviewing about health care reform, and they said, are you for a single-payer system? And he said, I am for a single-payer system, and the way you get to a Canadian-style single-payer system is that you develop a public option so that those who are on private insurance can no longer be on private insurance and drop their coverage and destroy the private competition marketplace and have to move to a public option. That's how we get to a single-payer system. And he said, I support a single-payer system. And I can tell you some other people in Congress that have said that same thing. So it's not a joke that there are some that are wanting to socialize our medical system. That is a true thing. There are some that believe that. Yes, that's right. That's right. So what can we do? Here's a couple of ideas. You know, when you switch jobs, if you have insurance coverage, your insurance doesn't stay with you. You probably move on to another plan, then you have a waiting period to where you have pre-existing conditions that won't be covered. And guess what happens when those pre-existing conditions aren't covered? Your health suffers because you may not go get health care, you may not get your prescriptions. So why not just have portability between health insurance plans, that your health insurance just stays with you? You might even be able to buy it across state lines where you have competition. People have to compete for insurance. Why not work with industry to see if there's some way that financially makes it possible, even for the private sector insurance carriers, to eliminate pre-existing conditions?
Yeah.
I have two children in college. In fact, last night I was out shopping with my son, buying his dorm room stuff. He starts college next week. I'm an empty nester and I don't like it. My daughter's in college right now, but when she turned 22 a couple of months ago, she was off my health insurance. And she's been on my health insurance since she was born. And she had to go out and get her own health insurance. Why not raise the age of our children to be able to stay on their parents' health insurance until they're 25? Until they can go out and get a job. And also, many of those in the healthcare profession business have to practice defensive medicine because they're scared they may get sued if they don't run a certain number of tests. I was at a hospital. I've been talking to all kinds of doctors and hospital people throughout the state. I was at a hospital just a couple of days ago in Bartlesville, and the doctor told me that his partners run too many tests. He said, I get on to him. He said, they run too many tests. It's cardiologists. They just run excessive tests. It costs a lot of money. And he said, I told him, you know, let's be reasonable about what we're doing. They said, no, I'm afraid I'm going to get sued. So we have a system that encourages people to do that. And by the way, there is no medical malpractice reform in this legislation. That has to be a key component of any type of health care reform in our nation. It has to include medical malpractice. For those that are in business that can't afford to pay for health insurance for their employees, and there are definitely those kind of businesses, why not allow those people to join together to spread the cost, to spread the risk, to find lower cost health insurance? Why not allow more basic insurance policies? You know, my 22-year-old daughter doesn't particularly need to pay for Alzheimer's care. Maybe later, but not right now. But that adds costs onto our system. I don't want to forget all my points. There's so many different things we can do. I'll tell you something that I'm a big supporter of, and there are some of these provisions in this legislation. I will say that. But we as a nation have not done our personal responsibility job in taking care of our health.
That's right.
We have too much diabetes. We are a little thick in the waist. And we have a lot of cardiac disease, high cholesterol in our nation. I think it is time that we have a call to action of Americans to pay attention to their health and to do their responsibility, try to take charge of their health. And there are ways that we can encourage that. That's right, our mayor did that. Our mayor had a weight loss program, didn't he? He did that. And actually there are great examples. I've already met with some Oklahoma companies to where they have healthcare programs that incentivize their employees to learn about taking care of their health and eating right and getting regular medical checkups and exercising. We have an obligation to take care of our bodies and to help lower those costs. That's one of the ways that we can look at that too. And I could go on. There's lots of other things that we could talk about with healthcare reform, risk pools for the uninsurable. I was talking to some ladies today in Seminole, and one lady stood up and she was crying. And she said, I have a couple of children. She said, I don't make enough money, don't have a job that pays for health care. She said, I get food stamps, I get Medicaid, I get housing assistance. And she said, I'm having a struggle taking care of my family. She says, I have a man that lives with me who I want to marry, but I'm not going to marry him because I'll lose my benefits if I marry him. Which, by the way, we discourage marriage and families sometimes with our government policies. And she said, he needs back surgery, he can't work, and I'm trying to take care of my kids, trying to take care of him. But if I start making a certain amount of money, I'm going to lose everything. And it goes back to that crazy policies that we have in our nation that we discourage people from trying to do better, trying to be responsible, or even getting married. Because we don't truly help those like her that really need help, that can't afford their health care. So that was kind of a sad story to hear describing that. But then on the other hand, I was in my cleaners the other day talking to a lady who was single, raising her niece, and she told me, she said, I had to drop my health insurance because it was $300 to $400 a month. But she said Oklahoma has a great program called Insure Oklahoma. That's a private, public sector partnership between employers who can't quite afford to pay for insurance but contribute to the state of Oklahoma, that contributes, by the way, through our tobacco tax funds. One good thing that thing does. And also for the employee who contributes. So you get all three of them putting some money in, and her insurance premiums were $60 a month. And she pays a $10 copay. There are innovative ways out there among our nation to help lower costs, create better access to care, and not diminish the quality of care while rationing the care, that we can explore as a nation without moving towards a single-payer socialized medical system. So, we need to do that, have healthcare reform in our nation, and you're here tonight to give me your opinions about that, I think, whatever you want to talk to me about, and I'll be happy to listen. Guys, would you move out in the audience, wherever you are, and if you'll raise your hands. Oh, I didn't know they were here. Is Representative Mike Thompson and Representative Kevin Calvey here? Where are you guys?
If you want.
There you are. There's Kevin Calvey over here. He's running for Congress. Mike Thompson's running for Congress. You're going to be replacing somebody great in Congress. That's a joke. Good to see you guys. Welcome. Glad to have you here. Where's Mike?
Congresswoman.
Yes, sir.
My name is Jeff Kelly. Thank you for attending. I've seen a video of a Representative Tom Price. He's a doctor, and this video is of him absolutely castigating the Democrats in the House for this health care reform bill. As I mentioned, he's a doctor, so he has some kind of insight. And my question is, how have you personally participated in castigating this egregious health care reform bill?
Well, if you go up on my website, you can see me on YouTube speaking on the floor many times. I've held several national press conferences on the issue. In fact, Tom Price, Dr. Tom Price, is the chairman of a conservative group called the Republican Study Committee, and Dr. Tom Price has made me his communications director, so that's how good friends we are.
The Attorney General of the United States, Eric Holder, recently told the state of Oklahoma that they will not get federal funds if we vote on a resolution to make English the official language of the state. As governor, what would you do when the federal government tries to blackmail us like that?
Tell him to mind his own business.
My question has to do with the fact that when Clinton took office, healthcare reform had begun a discussion about healthcare reform. Then we had 8 years of Clinton, and then we've had 8 years of Bush. But during that 8 years of Bush, there was no talk of healthcare reform. And I just really, we need more concrete stuff from you guys about what is your plan? What are you going to do?
Well, and let me just say, there were lots of bills introduced in the Bush administration too. There are a lot of bills introduced right now that are comprehensive packages. You mentioned Congressman Tom Price, who's a doctor. I think we have about 8 or 9 doctors in Congress, and there are several really good free market-based competitive health care plans that would bring about some of the reforms that I currently mentioned a minute ago without moving us towards a big government takeover of 17% of our economy. So there are plans out there. I would just suggest that maybe you go on the internet and search some of these health care reforms. There's all kinds of think tanks out there. They have great plans too, and they get introduced. The problem is, if the leadership of the House, which is Speaker Pelosi, refuses to let them come to the floor, and she does, then we can't have an open, honest debate. And I want to have an open, honest debate. And my hope is that when we get back in September, that after Congress has had an earful back home in their town hall meetings, I hope that reasonable conservative Democrats and Republicans can come together to get some of these major reforms done so we can address health care in America.
Thanks for your time tonight. My name is Grant Crairy. My wife is a new physician. We just moved here from Virginia to Oklahoma. She's a family physician. And though it's not entirely surprising, it's no less dismaying that she's found in her work that up to 90% of her time is spent on administration and paperwork. And that fact is driven by 2 key things.
So you can add this onto it later.
That fact is driven by 2 key things already today. Government intervention in the medical process and the reality of having to practice egregious defensive medicine. Please make malpractice reform part of healthcare reform.
Thank you for being here tonight. I talked to you earlier in the hall about, I want to bring up a little issue that a lot of the public is not aware of. I've found that when Oklahomans are aware of problems for veterans, they help us overwhelmingly, such as the tax thing. They voted 75% for it, to give us 100% as a tax break. I'm an honorary member of the Chosen Few. In 1950, 12,000 Marines were surrounded by 120,000 Chinese at the North Korean Chosin Reservoir. They marched 29 days in sub-zero weather, dragging 3,000 dead and wounded, killing 60,000 Chinese. They call it the last great hand-to-hand land battle on earth. In the Marine annals, the Chosin and Iwo Jima are our 2 worst battles that we've ever fought. I'm here representing about 100 Chosin widows that I have worked as that wrote their husbands 100%. They died before they lived 10 years with 100% permanent total. Those widows did not get any benefits when they died because their husbands lived 6, 5, 4, 8 years, 9 years. When a veteran gets to be 100%, and think about that, 100% you give up for your country. I call these Korean and World War II vets 200%ers because they waited 50 years to file a claim. Get on this issue, call these congressmen, and Ms. Fallin, Be our champion. We don't have one. You're a woman. There are women dying in anonymity. They have abject poverty. They go from approximately $3,500 to $800 a month. Nobody's championing their cause. Please champion the widow's cause.
All right, thank you. I will. And thank you for our service to our nation. Thank you for your service. I asked at the beginning of this year to go on the Armed Services Committee because I want to be in a position to stand up for our men and women who have sacrificed it all and have given so much of their life, their incomes to serve our great nation. So I appreciate your comments, and we do need to take good care of our veterans and our men and women, and even their widows. So thank you. I appreciate that. Here, I'll get this lady right here.
My question is, will you take the president up on his offer to go over the proposed bill line by line? You know, he invited congressmen to come and sit in the White House with him even and go over it. Will you go do that?
President Obama asked me to come to the White House and talk to him about this. I'll be more than happy to. He may not like what I say, but I'll be happy to go talk to him. He hasn't called my office and asked me to come over, but there may be a reason why.
I have two very quick things to discuss here. One of them is about the Federal Reserve, which has not been mentioned anywhere here. The Federal Reserve is the cause of a lot of problems here, and I want to explain that very quickly. Every dollar in every one of your wallets is already owed to somebody by somebody. This is why. The Federal Reserve is a private company. It is not any more federal than, as it's been said on the media, Federal Express. So what happens is we ask them for $1, they give us $1, but there's interest on it immediately, and they're the only source of our money. Therefore, if we want to get more money to pay that interest, we have to ask for more from them, which also has interest on it. If you look at the amount of money from 1913 when the Federal Reserve was instituted to now that is in our system, if you look at that amount of money and also the amount of debt on a pie chart, they go hand in hand. They just keep going up, and it's never going to stop until the Federal Reserve gets audited and shut down. Ron Paul, Transparency Act that requires the Federal Reserve to be audited before 2010 to prove that they have been lying and stealing all of our hard-earned money. We must shut the Federal Reserve System down. I feel like the media has been controlled by the people with money, people like the Federal Reserve, lobbyists, for too long. And what's happening is they perpetuate lies because that's what they choose to do. I'm not saying Republican, Democrat, whatever. We need to stop the lies. What we need to do is thank you. We need to have these people transparent throughout the entire system. So when people like Sarah Palin step up and say that there is a death panel on this bill, that is a direct lie, and it's been proven, and it's in there. Read the book. I suggest you all do it.
Well, thank you, and I'll just tell you that Ron Paul has authored a piece of legislation to audit the Federal Reserve and have transparency, and I'm a co-sponsor.
Thank you. Unlike your daughter, I didn't have any health insurance until I was 28 years old because my mother, a single teacher, she couldn't afford to have me on health insurance. So I had to use leftover drugs that she had if I was sick. And thank God my grandparents had some money to pay when I had a broken leg and stuff. But when I lost my job and my COBRA ran out, I couldn't get in other insurance. When I tried looking for places that had really high deductibles and everything, they said, oh yeah, well, if you pay us $1,000 a month, then we'll insure you. At the time I was working as a substitute teacher. When I had days I was lucky enough to get it, where I took home $35 a day. So obviously there was no way that I could afford that. I was one of those 49 million uninsured people, and I wasn't poor enough to be on Medicaid. I wasn't disabled enough to be on Medicare. and I wasn't rich enough to be able to be able to pay for those outrageous sums. And we've had competition with these different insurance companies, but they keep making the money. It's not competition bringing down prices. And when you talked about 9/11 and the horrible deaths of the 3,000 people that day, we need to remember also that there's 18,000 people losing their lives every year because they're not getting health insurance. And there's 14,000 people a day losing their insurance. This has been talked about since Teddy Roosevelt ran on the Bull Moose Party, to have a way of insuring everybody in America, because we are the only industrialized country. And when I hear talk about these other countries and there's more taxes, I worked with somebody, she had dual citizenship from Norway, and they had a great program there. We looked at our taxes, and I paid about the same in taxes as she did. But she had health insurance, and when her mother got sick, they had somebody that came in all the time. So we have a great system, but it needs to cover everybody.
But she, and I appreciate her expressing her opinions, because there truly are people who can't afford health insurance coverage. And there are ways that we can help those that are uninsured. I talked about some of that, and one of the things I talked about was the cliff that we have, that once you reach a certain income level, that you're either in or you're out. You know, I'd like to see us work towards helping people that truly can't afford that. But if you can pay some of that insurance, they'll let you pay what you can without putting you in or out of a system. And I don't know what that looks like yet, but there are some things that I think we need to look at in that particular area. So thank you for your comments. I appreciate that. All right, where's my guys? All right, Caleb.
I am a mother of 5, and my husband works for the state in public schools, and we cannot afford health insurance. We have chosen not to have health insurance because we could not afford the $750 a month. But we got an alternative. There are alternatives out there for health care that have nothing to do with insurance. We're considered uninsured, which insults me when President Obama talks about that number of uninsured, because I just want to scream through the TV, I choose not to be insured. But my question is this: I'm concerned about my choice in my health care, so-called health care. As a nurse, I'm very aware that when you say health care, you mean medical care. I also choose alternative health care for my family. And I choose to not walk in the scam of insurance. And as a nurse, I feel like I'm making an educated decision to do that. My question to you is, are you for allowing alternative health care to continue? And will you support our choice and not just our choice for prescriptions and doctors?
I think that's a great question. I do support people having the right to make their own decision, and that's what would happen if we move towards a government-run system. They're going to mandate that you go under this public system. So I will not be for a system that mandates that you have to join a public government-run system.
But are you for?
And I do appreciate alternative medicine too. I'm not opposed to that either. Yes. All right. Let's see. Where are you? There you are. Couldn't find you. Derek. You got some ladies back here? Thank you for being here. You're welcome.
I'm a nurse, and last Sunday I had to send a 95-year-old patient to an ER here in Oklahoma from an assisted living center because he was having a very sudden decline in his health. And I sent him there. And they wanted to send him back to my facility with an x-ray because they thought that the doctor was dumping a nursing home patient in their ER. Now, luckily he had a daughter-in-law that was there that was willing to go to bat for him. And I told the daughter-in-law, you look at the doctor, you look at the nurse, and you tell them you want to see hospital risk management right now, so that you will get the care he needs. Because I had already talked to his family practice physician, and we knew there was something wrong. If the government is running this, who do I go to? There is no risk management in the government. Then what? Then my patient's going to come back to me and he's going to die. And this man, although he was 95 years old and a DNR, knew everything that was going on. No dementia, no nothing.
Well, thank you.
Who do we go to if the government's running this?
That's right. I think you made a great point. I appreciate that. Derek, we haven't got to any of these people on this side of the room. Let's come over here to this side here. Let's get this man right here, then we'll move over here.
Thank you for being here. We've had a lot of stuff about the health care and others, but in our founding papers it says the government is to ensure our life, liberty, and pursuit of happiness. The pursuit of happiness is not a guarantee. Okay, secondly, as far as our liberty does not include being indentured to a federal deficit. And as far as the life go, it doesn't include the obligation of the government to provide health care. That's right. I would make 2 points. One of them is that I think we've talked about tort reform. I think another big issue is the aggressive prosecution of Medicare fraud or any insurance fraud. In this area, I would ask is that you ensure and commit yourself and your other Congress people that all Congress people would be subject to the same health care. Though, one of the obligations in our Constitution of the government is that they regulate our currency. This inflation is the equivalent of devaluation of our dollars. We can't tolerate that. They are not regulating it when they just print more money because they can. I'm back to my partner's statement earlier. We cannot allow. I think I saw this. This last year's budget is 4 times greater deficit than the previous year. Who asked for that? Okay, we don't need any deficits spending at all. Let's get that under control. It will die under the weight of it.
Yeah, and let me. I appreciate your comment about Congress being under the same health care plan that you are. I've actually co-sponsored a bill that says if this thing passes, that all of Congress should get the same type of health care mandated by the federal. Went through one of the committees. Some of my friends offered an amendment in committee to this bill that mandated that if this goes into law, that Congress has to be under the same type of health care plan. And guess what? And guess what happened? They voted it down. Shame on them. Shame on them. Anyway,
keep trying.
We'll keep trying. Okay, yes, ma'am.
Good. I have a quick question. We were up here talking about socialized medicine and how we don't want America to turn into a socialized country. You haven't mentioned the fact that we have a lot of socialized systems already in place. The police department, the fire department, the school system. So I would like to know what's the difference with healthcare. If people have the right to go to a public school system and everybody has a God-given right to go to school and get an education, why don't they have a God-given right to go to the doctor when they're sick? And my second question would be, are you willing to give up your government backed health care? And take a stance? Are you willing to give it up since you are so against socialized medicine?
Now let me just say, I believe that you have to have systems in government that provide for the safety and security of our citizens in our nation. It's government's job. And that's why we joined together as a United States of America to protect our nation, to form democracy, and to take care of our people. Now, I'm one of these big state rights advocates, and believing that but I also think that there are things that we have to do to provide for the safety and the tranquility of our nation so we can live as a peaceful nation. I'm not against having a military, are you? I'm not against taking care of those that can't take care of themselves. So, I guess that's a question you have to ask. And as far as giving up my health insurance, I will go under the same health insurance plan if they pass this, if that's what they choose to do. But if they don't pass it, then I'm going to have the same, yeah, thank you. Thank you. That's right. We're going to try to reform that healthcare system. Yes, sir.
Got a couple of points. One, I'd like to dispel something the gentleman said over there about the Federal Reserve. They don't print money. That's the Treasury. Now, that's just a clearing bank, folks, the Federal Reserve. If you write a check on one bank, it's got to go through the Federal Reserve to get to Woodward. Now, the other thing I wanted to ask was House Bill 1045. Are you familiar with that? It has to do with gun control.
Yes. I'm against gun control.
Okay. And the next thing I'd like to address is, how did the money get from Obama's mouth to Acorn? And how much was it?
Well, frankly, I don't like Acorn either.
None of us do.
None of us do. Yeah, and actually it came through different agencies and budgets, and I'm not even sure which federal agency it was, but it came through allocation money. I have to tell you this, that I am an hour and a half over my time for this facility. And I appreciate the career tech, Tom Friedman, letting us have this facility for so long. I know it's 8 o'clock. We were supposed to have been finished a long time ago. So thank you, Tom. I know there are a lot of people who have questions. I have a lot of staff here. These two gentlemen here, the two gentlemen with the microphones. Thank you so very, very much for your input. It is very helpful to me. I appreciate all of you coming. If you would like to see one of my staff people, I'd be happy to take your card and get back to you on any issue that we possibly can. Thank you for coming. God bless you.